All right, good morning, everybody. Thank you so much for being here and for focusing on our out-of-control costs of prescription drugs here in the state of Michigan. I have good news to report. The Senate just passed out a bipartisan vote, the Prescription Drug Affordability Board. We're very excited to keep this conversation going. For too many Michiganders, we know that we are forced to make impossible choices between paying for their prescription drugs and paying bills, something we hear all the time. Families across the state are cutting pills in half, stretching what they can to get by, while big pharma companies continue to boast about record profits. These companies are exploiting our seniors, those with chronic illnesses, and so many others by charging outrageous prices for life-saving medications simply because there's no system in place to hold them accountable. That's why Michigan Democrats and one of our Republican colleagues today have been fighting to create a Prescription Drug Affordability Board, or the PDAB, right here in Michigan. PDABs are a nonpartisan, independent board that will bring transparency to drug pricing. We are not alone in this fight. States across the country are exploring and implementing similar boards, but right here in Michigan, the need is urgent. Over the past few weeks, we've held a series of town halls across the state. I know some of us here have done that. And the response has been overwhelming. People are sharing their personal stories of dealing with the high cost of prescription drugs. I know it moved me on my town hall. I know it moved a lot of my colleagues as well. And it just continues the need for action. We hear from parents, from seniors, from hardworking Michiganders who are rationing their medication, skipping doses, or going without it altogether. We've also heard from healthcare providers and experts who agree that we need accountability and we need it right now. It is abundantly clear that the people of Michigan are not just ready for change, they are demanding it and overwhelmingly support this legislation. Our fight didn't start today. We've been working on this for some time here in the Senate, but I invite next Senator Kleinfeld to talk a little bit more about our background and our efforts. And thank you again. I just want to reiterate, today was another big step in lowering the costs for our residents, and we did it on a bipartisan basis. This is not a partisan question, and we look forward to continuing the movement on this legislation. So, Senator Kleinfeld.
Thank you. Well, I'm going to be real short and sweet. In 2023, the Senate passed these bills, but they didn't make it to the governor's office, unfortunately. So just as he said just a few minutes ago, we again passed them out of the Senate. We are reaffirming our commitment to lowering the skyrocketing cost of prescription drugs in Michigan. This is just one tool, but it's one important tool, and we're putting an effort and getting the ball rolling, and we look forward to working with the House to getting this legislation through and getting it to the governor's office. Now, to walk us through the PDAB, the ins and outs of it is Senator Schenck. Thank you.
Thank you, Senator Kleinfeld. At the core, this package is about fairness, accountability, and making sure that every resident has access to the life-saving medications that they need. The Prescription Drug Affordability Board will be made up of independent experts with no financial ties to the industry who will analyze and evaluate drug prices across the state. A Prescription Drug Affordability Board would be required to give an annual report to the legislature on prescription drug price trends, the number of products reviewed, appeals outcomes, and recommendations for further legislation to make prescription drug products more affordable in Michigan. When a drug cost is determined to be unreasonably high, the board can set an upper payment limit. So it could be lower, the price could be lower. An upper payment limit is a fair price that protects both consumers and the integrity of our healthcare system. This board is not about stifling innovation. It's about stopping exploitation that is happening now. Big Pharma's profit margins are significantly higher than those of other industries and up to 10 times greater than those of different sectors within the prescription drug supply chain. Meanwhile, taxpayers, yes, those who then buy the drugs, are funding a lot of the research behind these drugs. This legislative package prioritizes people over profits. It's about making sure that no one in our state is forced to choose between their medicine and their mortgage, or between their health and their prescriptions. We have the backing of doctors, nurses, patient advocates, and hardworking Michiganders who are living this reality. We've heard from too many residents across the state who are delaying care, only taking part of their prescriptions, or going into debt just to fill a prescription. That's not okay. With this legislation, we can make sure that Michigan residents won't be forced to pay more than what's reasonable for important medications. The Senate has passed this legislation twice, and it's time to turn these bills into laws. With that, I will pass the baton to one of our partners in the House who is helping to lead the charge to move this legislation forward, Representative Dr. Matt Longjohn.
I think we're going to have a different order. Is it Denise?
Yeah.
Representative Denise Menzer.
Thank you. So what my constituents want and need is prescription drug affordability. Prices are very high right now, and medical debt and prescription costs are sinking families and making them difficult for to meet their needs. I'm going to tell you a real brief story. When I knocked doors in 2024, I came across a man, probably in his 60s, who told me that his employer, under his past prescription drug plan with his employer, his diabetes medicine was $80 for a 90-day supply. His employer switched healthcare providers, and that same medicine, the same dosage, the same time frame went from $80 to $450. That's criminal as far as I'm concerned. So I want to give thanks and applause to the Senate Democrats for passing this essential legislation. And now I'm going to call on House Republicans to take it up so that we can all work together on this priority. Michigan's livelihood depends on it. Not only these bills, but my bill, House Bill 4329, which would prevent credit agencies from reporting medical debt on a consumer's credit card. It's about damn time that something is done to bring down the burden of prescription drug costs on Michigan families. This is long overdue. It's time for us to get it done. So listen to me, Republicans. Thank you. And now, Rep. Scott. Thank you.
Hello, everyone. I'm so glad to be here to speak on this legislation, and thank you very much, Rep. Menzer. While Republicans are threatening Medicaid at the federal level and trying to defund health care here in Michigan, the Democrats in the House are taking action. House and Senate Dems are standing up for families, protecting health care and lowering costs, because everyone, and I mean everyone, deserves affordable health care and also peace of mind. I'm thankful for all my colleagues in the Senate, and we are ready to get to work in the House and make sure that this package goes through. Thank you.
Thanks, everybody. Good morning. Thanks for being here. And congratulations to my colleagues in the Senate for getting this important piece of legislation through on a bipartisan basis. Incredible work. Thank you. I'm State Representative Matt Longjohn from the 40th House District and a rookie and the only medical doctor in the legislature. And so I'm very excited to be here today to be a part of this event and a part of this important legislation. I might be a little too excited. This is actually going to be the first bill that I introduce when I get downstairs with my colleagues in the House to introduce this as part of my beginning of a legislative career. So I'm really excited. But I'm excited not just because of that, for this being the first bill I introduced, but because this is like a promises made, promises fulfilled kind of thing for me. For anyone who's heard me talk in the last 7 years, I've been laser focused on what I could do to help improve the health and quality of life of all Michiganders. And so I'm always talking about lowering prescription drug prices and thrilled to see this moving forward. The truth is that Michiganders, like all Americans, are paying too damn much for their health care. The average cost of health care in the United States now is $14,000 a person. We have capped over $4 trillion in annual medical expenditures for the last several years. $14,000 for every man, woman, and child in the state of Michigan. So whether you are paying out of pocket, whether your employer is paying for your health care under an employer-sponsored health plan, or whether as taxpayers we are paying for every senior on Medicare or every mom on Medicaid, we are all paying $14,000 a year, and we aren't getting what we're paying for. We have to follow the data, and the largest increase in healthcare costs are coming from pharmaceutical costs. It's not just healthcare. Healthcare is growing 10% per year, and I don't know anybody who's getting 10% per year increase in their paycheck. So we're all falling behind. But if you follow the data, you'll see that the largest increase in healthcare dollars are coming from prescription drugs. We just had a hearing last week in the House about a difference between the actuarial expectations of Medicaid in this past year and where we ended up. It was to the tune of about $250 million difference. It turns out that we're spending $20 million a year on things like GLP-1s, $20 million a month. So it's almost the entire difference. And I'm a prevention medicine guy. I want everyone to have access to incredible medicines. I want to prevent diabetes and high blood pressure and stroke and heart attack and dementia. We want people to have the best available medications. But if we can't afford them, what good are they? That's right. So this is a really important step. And I want to note that President Trump's tariffs, as well as the slash and burn tactics in Washington and here in Lansing to diminish our Medicaid, are also going to be driving costs up for folks. So we, as Dems, need to stand up and fight for the pocketbooks of our constituents and for taxpayer value by advancing the PDAB legislation. In 2023, there were 47 new drugs approved by the FDA. The average cost of those drugs was $300,000 per person per year, up from only $220,000 per person per year the year before. A 25% increase year over year in prescription drug costs. So if we want to make taxpayer value a thing, if we want to fight for our families, we have to address prescription drugs. I'm going to close by recognizing my friends and neighbors in Portage, Michigan, which is the global headquarters for the vaccine production for Pfizer. We were so proud in my community when those trucks rolled out of Portage to help the world respond to the pandemic. And I just want to note for my friends and neighbors in Portage that this is for you. This will not affect your jobs to the degree that tariffs do. So I hope everyone will stand together and move this forward. And I know that Rep. Scott, Rep. Menser, and many more of my colleagues from the House are ready to fight alongside the Senate to get this done. Thank you very much.
Let's make it happen. Questions? Oh, excuse me, Doctor. Come on up.
No, it's okay.
We're all Kalamazoo College grads.
Yeah.
We should have been in better
No,
sync
that's
than
okay.
that.
That's cool, because I was going to come up here and call him Matt, because I've known Representative Longjohn since the late 80s when we were freshmen bio majors and pre-med students, and was excited to watch him in a career of public health as I took on a career taking care of patients at the bedside. My name is Rob Davidson. I'm an emergency physician in West Michigan, also the executive director of the Committee to Protect Healthcare. I have some talking points, but I'm not even going to put on my glasses because I don't need them. I thought about, as I was standing up here, who I'm representing. Well, partly I'm representing the Committee to Protect Healthcare. We're an organization of thousands of doctors, 30, 40,000 around the country, thousands of doctors here in Michigan who are just out there fighting for affordable health care for our patients. I'm representing the 22 organizations you see over here on this board as an organization that is leading that coalition to help support lower healthcare costs, lower prescription drug prices. But then I was doing some mental math, and I've been an ER doc for almost half my life, almost 27 years now, and I'm really here representing the 60,000, maybe 70,000 people I've seen all over those years. It's kind of a mind-boggling number for me to think of as my hairline is receding, but it's true. And it's because this issue of high prescription drug prices has been there since 1998 when I was first an intern and saw my first patient, and is there today when I worked a shift yesterday afternoon after testifying in the Senate hearing here about PDAB and then coming back here because I think it's so important. I'm excited to drive across the state multiple times to talk about it. I had a patient yesterday who came in with high blood sugar, out of control, and the rest of their blood labs were out of whack and had to be admitted. And it's because they were cutting their insulin. They thought they could make it, they thought they could afford it, and then they had an unexplained expense. And that's all people in the state are away from one roof that caves in, one muffler that falls off their car, and then it blows their whole budget. When they've pieced together their monthly budget to pay for drugs, to pay for food, to pay for their kids, to pay for their living expenses, and then something happens that they can't avoid. If you have to drive your car to work, you have to get it fixed. And if that's $500, that's money you can't spend on insulin and other drugs, and that's how you end up in the ER unexpectedly. I'm seeing talks in Washington about protecting vulnerable people to keep Medicaid as they talk about Medicaid cuts. And I look at every person I see and everyone in this room and behind me, we are all vulnerable to some extent or another. Some of us are one muffler away from catastrophe because we can't take our meds. We end up in the hospital. We get bills for being in the hospital, and the cycle continues and continues. So I think legislation like a PDAB, to have our government create a law that appoints an independent body of experts to set drug prices for the most expensive drugs. That's something that they say that people in Michigan can afford and will hopefully keep them away from catastrophe when they lose a muffler on their car because they can't afford their drugs. This, to me, is one of the most meaningful things I can imagine as a physician, as a healthcare advocate. As an organization, the Committee to Protect Healthcare is excited that we helped pass PDABs in other states, specifically in Colorado. And they've named 3 drugs to set upper payment limits on thus far, and are this year going to start talking about the first drug that they're going to set the price for, Enbrel. And yesterday I was at the hearing, and lobbyists from pharma, because that's what pharma does, they bring lobbyists to this discussion, was talking about the fact that, and a state senator, a Republican state senator, was talking about the fact that, well, we haven't seen drug prices set yet in other states. And that's because they get tied up in legislation by pharma, because we know big pharma makes more profits than almost any other industry in this country. And they're doing it on the backs of the people that I take care of every day. This is particularly true in rural places where I work, where, again, people are so close to the edge, and one illness and one missed medication will put them over the edge. So I lost where I was even on my talking points, but I don't really think I need to go any further into that. I'm excited that the Senate, I'm excited it was bipartisan. I think this should be bipartisan. I think that if Republicans in the House are smart, they will make this bipartisan and negate this as a talking point in the next election cycle, because our patients need the help right now. We can't wait for politics. We can't wait for new elections and new houses to get sworn in. We have to do this as soon as possible. So thank you for the folks in the Senate who did it today. Thank you for the folks in the House and my friend Matt, who's going to lead the charge. And hopefully we get this done, because our patients can't wait any longer. Thanks. And I think questions here.
All right. Now we can ask questions. Anything?
Hi, Sam Schreiber of Mercedes. So it seems that one of the big points of opposition against this is that upper payment limit authority. Is there any world that you would be willing to negotiate minimizing the upper payment limit or getting rid of the upper payment limit?
The upper payment limit is the point, so no. If they have other plans that they want to provide and talk about lowering the cost of prescription drugs, let's see them. You know, we heard our Republican colleagues who voted against this today talk consistently, well, this has this hole here or that has. They're making up talking points because they don't have a plan. And so if House Republicans want to come to the table with a plan, let's have a conversation. I've been an above all approach legislator. Give me every idea. This is one idea. We think this will work. We should do it. If there are others, let's talk about it. And so I'd love to see what they're hoping to bring to a conversation about lowering the cost of prescription drugs. We have not seen a plan from any Republican in the last 3 years now of what it would look like to lower the cost of prescription drugs. All they've done is attack this one. So let's see what they want to bring to the table.
To the House members that are standing here and were serving last term, the Senate passed this in October 2023. Is there any explanation as to why your caucus did not put this up for a vote last term?
Anyone want to go?
I have no explanation.
Yeah.
No explanation?
No.
Did anyone say anything? Hey,
I'd be glad to jump in.
But you weren't here.
I wasn't here last time, and that's the point, right? Not because it's on me, right? But because we can't wait and worry about what happened in the past. People today are choosing between paying their groceries and filling their prescriptions. So this isn't about retrovision or figuring out what didn't happen in the past. This is about what we can do now. And the evidence tells us that what's happening in Colorado, what's happening here, gives us an opportunity to help Michigan families all over the place. And we should not be worried about what didn't happen. We should be thinking about what we can do.
Just to follow up on that, if the lawmaker blocked this from being voted on last term, you all are saying this is going to lower prescription drug prices. You don't think people should know who was blocking these bills last
Well, I'll just, as an outside observer from the Senate, watching this play out and being very frustrated at the process that took place, I'm sure there were more than one person that were involved in that decision-making process. But there is one thing that is clear. During lame duck, there were hundreds of bills that the Michigan Senate had sent over that we were hoping to take action on. And a lot of it got caught up in the theatrics and the dynamics that now Speaker Hall orchestrated and created to stop anything from happening, including walking out on the job for 2 weeks. And so we were attempting to get that bill done in the House during lame duck, but every House Republican walked off the job. If any regular citizen walked off the job, no call, no notice, they would have been fired. That's point blank, plain and simple. We were in a situation where we just couldn't do it as a part, and we couldn't do a lot of things, unfortunately. And so we're hoping to bring that conversation back.
So talking about today, to the House members here, how many votes would you guess that you have in the House for this right now? If they were brought up on the floor today, how many would you bet that the House has?
Well, my hope is that all of our caucus members will be voting in favor of this.
Would you be willing to bet money on that?
I'm not a betting person. Thank you.
Other questions? Yes,
Have
Simon.
any conversations with Republican House leaders about the prospects of this bill receiving the vote, or
I'm ready to have that conversation now that we've moved it out of the Senate. It seems as if, and we do a lot of things in the press apparently with House Republicans, so I am asking our House Republicans to join us in this conversation. So if any of the committee chairs or if the Speaker himself wants to have a conversation with myself, Leader Brinks, we're ready. Let's have a conversation about lowering the cost of prescription drugs for people.
how do you feel about the prospects for the success of this legislation in the House relative to last year?
It is one of those things that should be bipartisan. We pass it on a bipartisan basis today. This is not an issue that, Republicans somehow don't have high cost of prescription drugs. We all do. And so their constituents have been asking for it. In my downriver area, I have several Republican legislators in the House. They're hearing the same stories that I'm hearing. And so they should be caring about those issues as well. I'm hopeful that they will. Yeah, go ahead.
So that's why we're here, right? You put it out there, constituents read about it, they make phone calls to their representatives, and maybe we have a fighting chance. One of our colleagues stood up on the floor and said, gave a speech about a free market society. Well, in a free market society where there's supply and demand, the consumer isn't held captive as they are with prescription drugs. They don't have a choice to walk away like you would in a regular free market society where you can say, I don't want that car. I'm not going to pay that price. They're held captive in this situation. So, we're making a move, and we're inviting our colleagues on the other side of the aisle to join us and on the other side of the building to join us.
I wanted to add one more thing about the bipartisan nature of this bill. My mom lives in Senator Lauer's district, and he just voted no on this. My mom calls me every week with a story about one of her neighbors or friends who can't take their medication for Crohn's disease, the medication that worked, because they can't afford it. Her neighbor who can't take his diabetes medication because he can't afford it. And her other neighbor who can't take medication for their heart because they can't afford it. They live in a Republican district. Their bodies don't care who represents them. Their bodies need the medication, and they can't afford it, and the PDAB is going to make it so that they can afford it.
Senator, let's go to Colin, and then we'll take one more.
For the House members about the legislation introduced today, have there been any efforts to get Republican co-sponsors? Are the Republican co-sponsors you're expecting, and what's the effort to get that to a committee hearing?
I'll be glad to jump in. Like I said, this is going to be, I'm literally picking up my first blueback today. So, I've sent a memo to all House members this morning asking for those co-sponsorships. We have a short session in the House, and we actually have to get going to be there by noon today. So I don't think we'll be able to tell you the answer to the question today. I've extended the invitation to people on both sides of the aisle to co-sponsor this package through Tuesday because we have such a short session today. So we'll know more in the coming days.
Can I just add as Just as a House member who was here last term and is strongly supportive of this legislation, I think it's long overdue. I think the question that our constituents and that the press need to be asking the Speaker and our Republican colleagues and our Democratic colleagues is, why wouldn't you support this legislation? Do you not understand that your constituents, your families, and your friends are struggling to pay for their medications? This is a real issue in our state. We should all be supporting this. We should take the politics out of it. We should get it done because it's long overdue. And I think that's the end of the story. So it is on our constituents and the press to start asking these questions and to really put the pressure on legislators to do the right thing and get this done. Thank you.
Are you aware of any Democratic colleagues that didn't support this last session that have changed their mind now?
I'm not sure. I don't know. We never got to the point where we were voting at last term, so we didn't see where the chips fell. But I suspect a vast majority of our caucus, if not everybody, would be on board with this. I don't know why they wouldn't be.
Sam, take us home.
What are you willing to give to get on this? You know, would you be willing to maybe do the income tax rollback or the emergency backup budget?
What I've heard over and over again from House Republicans is they want to have conversations in silos. So let's have a conversation in silos. They want to talk about the Public Safety Trust Fund alone without anything else. Let's have a conversation about this alone. It is the right thing to do, so let's talk about it. If they want to lower prescription drug costs in a different way, bring it to the conversation. I'm happy to have that discussion. Thank you all.
As you can see, our representatives have to get down to session, so we'll let them go.